Welcome back to We Are Austin, where it is time for our Medicare Monday with Mackenzie. This is our monthly segment with Mackenzie Anderson, who's a licensed agent with Premier Medicare Solutions. This month, we're discussing circumstances where you can take Medicare before the age of 65. And joining us with Mackenzie this morning with Premier Medicare Solutions is customer Mark as well. And Mark's going to chat a little bit about this as well. Good morning to you both. Thanks for joining us.
Thanks for having us, Trevor.
We love having you, Mackenzie. This is a great conversation. We love Medicare Mondays. Here's a great point. Many people do think you've got to be 65 to receive Medicare benefits, but you say that is not the case. So how can someone qualify prior to that?
So there are a few different ways you can qualify. Okay. If you have ALS, Lou Gehrig's, or end-stage renal disease or kidney failure, you can qualify for Medicare. In Mark's case, we have Social Security disability. So if once you're on Social Security disability for 24 months, then you're automatically enrolled into Medicare.
Interesting. Okay, so that's great to know, first of all, for folks out there. Do those come with special enrollment periods for people that are on Medicare due to a disability that they should know about?
Yes, yes. So you do have that 24-month waiting period. And since you're already drawing your benefits, you are automatically enrolled in Medicare Parts A and B. Just like when you turn 65, you have a 7-month enrollment period, known as your initial enrollment period. And so with this, it'll be the month that your Medicare starts, so that 25th month, and then you have 3 months before and 3 months after to sign up for additional coverage, such as Medicare Advantage plan or a prescription drug plan. You can also enroll in a Medicare supplement plan, but your options are severely limited.
I see, and that's something you can help people navigate.
Of course.
Just like you did, Mark. Were you kind of surprised to learn, you're a young guy, were you surprised to learn that you were qualifying for Medicare at such a young age?
Yes, I actually really was surprised. When I first met Mackenzie, I was actually in college, and so yeah, it was surprising to me. I didn't believe it at first. I thought it was a scam at first.
yeah, but no, it's just it's one of those sounds too good to be true things, but with Mackenzie, it truly is true. How has Mackenzie kind of helped you find that best plan that worked for you?
Just by working with me. I mean, when she met me, she knows that I'm blind, visually impaired, so she read me everything that we needed to go through, walked me step by step. Anytime I have any questions or I'm confused about something, I can reach out to her and she'll reply as quickly as she can. So
that's so helpful. It must be, especially because Medicare at best can be confusing.
Yes.
I imagine especially when you're dealing with certain challenges, it can be even harder. What would you say to folks out there who might be thinking, I can navigate that on my own. I don't need Mackenzie. I can figure it out. Sounds to me like probably worth having Mackenzie in your corner.
I would say that, yeah, you might think you can figure it out on your own, but it's okay to ask for help sometimes. Never be ashamed to ask for help.
Absolutely. That's a great way to put that, Mark. I wonder. And so you are chatting about these things and all kinds of things on your podcast. What's that upcoming next topic?
Yes, so the podcast, it airs on the last Friday of every month. So for this month, I interview Ashley Rogers. She's a licensed clinical social worker and founder of Life Chats Therapy. And so in this, we talk about all of the very common mental health conditions that all of us go through, and how insurance, particularly Medicare, can help with some of that cost assistance. So it's a really, really great episode. In addition to what Mark said, don't be afraid to ask for help. We all need help. Utilize the resources that you have, and if you need help getting connected to those resources, then that's something that I would love to be able to do. And so you can get the podcast anywhere that you listen to your podcast.
Well, that's a great topic, and I think a lot of people might not know that, so thank you, and a very timely one as well. All right, Mackenzie, probably everybody at home is wondering, well, how much does this cost, and how can I get started?
Doesn't cost anything. We're not allowed to charge. So if we help people enroll into a plan, we do get paid by the carrier, so therefore we are not allowed by contract to charge individuals. I wouldn't do it anyway, but you can get in touch with me. You can call me, text me at 512-599-9527, or send me an email at mackenzie@premiermedicaresolutions.com.
And you can see the website on your screen right there. What a great service that you are providing. And thank you for, Mark, thank you for coming along today to give your testimonial. I think it's really helpful for people at home to really hear how it has worked for just the average guy out there who's, or average person out there who was looking for help. And this is something that you're glad you did, yeah?
Yes, I am glad I did. It's been very beneficial and helpful.
I'm glad to hear that.
And my life has been a lot better since I've known Mark also.
I like that too,
Yeah,
and it seems it's a relationship that you're forming.
Yeah, it really has blossomed into a wonderful friendship there.
Yes, it has.
Well, I love to hear that, and there's a lot to that is a journey going through the Medicare process together. So I imagine you probably are together quite a bit and working on this quite a bit, and we really appreciate your being able to help this community in this way. And Mark, for you joining us today to tell our viewers a little bit more about your journey. Thank you both for being here.
Thank you.
Thank you.
Appreciate you, and we'll be right back with more We Are Austin right after this.